Thanks, Gina. All right, we're just going to roll this video. I have one disclosure slide that I'm forced to put up that has nothing to do with the video, so you can go ahead and roll the tape. This is one of my own patients, and then some videos I grabbed off a line.
I think it really did start to get bigger when I was training for an Ironman, and as I was training and dropping weight, I think I did realize how much bigger it was, and that it was starting to hurt when I worked out. So finally I decided to deal with it when I needed to have, it was just a couple of years ago, and so that would have been 2015 or 2016. I needed to have a bladder sling, and I had to have a partial hysterectomy, and I had to have enough other things done where now I had to sit still anyway. So I thought this would be a good time to get it taken care of. There was no additional general anesthesia, there was nothing else to worry about, and I had to sit still. Not to have the belly button protrude through the shirt anymore, so that I could wear things that were a little bit tighter. It was also so that it didn't bother me and wasn't getting bigger. I think it was upsetting my stomach a little bit. I think if I were to have another pregnancy and we're getting the hernia repaired in between, my instinct is to think that the mesh would be better because, and I don't know anything about it, but I'm imagining that there would be some types of mesh that would have a little bit more capacity to expand than stitches. And if you have something inside you and your stomach's going to get that big, you want it to be able to accommodate that growth. Obviously my skin or my belly button didn't accommodate the first time it was growing, so maybe with a little help it would.
You had your hernia repair about 3 or 4 years ago?
About 3 or 4 years ago. Yeah.
And have you had any problems since then?
No problems. Everything's been good. And I've thought about whether I had problems when you hear the commercials on TV and they say, if you've ever had mesh, and I thought, is that what I have? But no, I've never had any problems. It's all been good.
Layla Hackett was told she had an umbilical hernia in 2013, 6 months after she gave birth to her daughter.
Whose party is it?
Surgeons placed a large piece of mesh near her belly button to cover the hole.
Straight away, I could feel it. I could feel the whole thing. I could feel exactly where it was. It was across there. And it started out being agony, absolute fiery, burning agony. Obviously, it didn't carry on being like that, but it never stopped hurting. So what else happened today? Have you finished your...
Layla told her GP about the pain many times, but was told it was nothing to do with the mesh.
It's like somebody scratching you from inside all the time, not being able to get clear of this horrible feeling. It's so unpleasant and it's so constant. Eventually, I ended up being ambulanced to A&E because the pain got so agonising I was just screaming on all fours.
Layla's bowel had twisted after the mesh became stuck to her internal organs. A surgeon spent 4 hours picking the material out.
And he said, well, it turns out you didn't have a hernia, you just had this separation of muscles, so we haven't had to put a new mesh back in. And I can tell you now, I knew there wasn't a mesh before they told me that, because I could just tell it felt normal.
There's a Canadian hospital which is world famous, well, at least in the groin hernia world. The Shouldice Hernia Centre says it has nearly a 100% success rate.
And this, Mike, this is just the discordance sometimes between what we think are the outcomes and what our patients think. And, none of us have a 100% success rate with anything. And here's some just recent examples that I just grabbed off of the internet from the same place that's claiming a 100% success rate, where one patient was actually told, I know you're having pain, but there's no recurrence, so the surgery was a success. And this is just even recent from 2018, somebody that had 2 operations to relieve pain after 6 years. And the most interesting part of this particular post was the response from the hospital saying that in over 70 years they had never heard of a bad outcome. And the response below that was just, wow.
Shoulder ice technique relies on a surgeon's skill, which companies can't really make money from. They can, however, make money from selling mesh. Peter and Sue are convinced that is why the synthetic material dominates the hernia industry. Chances are the mesh that was used for your hernia was something like this.
Oh my God. No wonder it itches. I mean, it's really thick, just like nylon. It's like nylon.
It's very pliable. It's very easy to lie flat like a pancake on the muscle. Also, you can see it's very, very thin and quite soft.
Yeah, but I mean, it's also quite thick. It's, whoa.
And then this is just somebody also, patient, some blogging thing, but you can see 4 umbilical hernias. At least that was her perception, so we don't think the same things all the time.
Day after my surgery, I have little Precy in here with me.
I'm big girl.
Oh, big girl, sorry. In a lot of pain. So I'm obviously really swollen at the moment, and I've got my 4 incisions. I thought they were only going to make 3 keyhole incisions, but they ended up doing 4. You can see 1 there and then 3 there. And I'm very swollen. But all of that will go down, and I really feel confident with how I'm going to recover. So, yeah, I will keep you updated.
So the important thing, and Gina alluded this to a little bit, is you just have to find out what the patient's really thinking and what their goals are. Make them your goals. Pick a technique that you think is going to best realize those goals, and then if you're going to use a mesh, pick a mesh that's best suited to that technique. It's not really a one-size-fits-all, so we'll go ahead and move on.